I got to thinking about this when I was required to attend a CME event at our hospital as part of a quality measure for our ACO. And the topic was on physician burnout. And so I spent an evening at this talk, and a mid-level provider was telling us that we needed to do yoga and eat healthy and take breaks between patients and spend time outdoors. And it really annoyed me. I felt like, well, I know how to take care of myself. And then when I saw an article by Simon Talbot and Wendy Dean suggesting another way of looking at physician burnout. Instead of being a little condescending to physicians and saying, you should go take better care of yourself, perhaps the issue is with chronic stress from something they call moral injury. So moral injury is a post-traumatic stress-like response to chronic stress of competing values. So when you're forced to do something that is in conflict with your deeply held moral values. And Dean and Talbot suggested that that's what's happening in modern medicine. I got to reflecting on my own journey and thought of several examples where I thought there were some moral injury-like stressors in my own life. I developed horrible neck and back pain. And so I started getting massages. And after a while, I realized that the real issue wasn't that I was, now had the computer over here and was twisting my head to maintain that physician-patient relationship that was so important to me and to my patients, but that the real issue was probably deeper than that, and that it had to do with the attention that our electronic health records require of us that actually detract from our interaction with the patient. A patient who had normal tension glaucoma, low pressures, he'd never had a high pressure, he didn't have any risk factors for normal tension glaucoma, and he was progressing at very low pressures, and he had these central scotoma, and I thought he needed an MRI. When I asked him about doing the MRI, he said, "Oh doc, I can't afford it." And I pushed him quite a bit to get this MRI, and he quit coming to see me. And so I went home and I worried about asking this man who had a high deductible insurance to spend $2,000 for an MRI. And the question I asked was, wait a minute, whose job is this? Is the deductible too high? Is the hospital charging too much? Is something wrong with our health system? And if he does have a brain tumor, can he afford to get it taken care of? And one more stressor, am I liable for this man and his well-being if he does have a brain tumor and I can't get the MRI? So these are the kinds of chronic stressors on our lives that really, I think, symptoms of burnout for doctors. And we don't just need to go do more yoga. Ophthalmology on the Medscape burnout survey in 2020 ranks about lowest on the scale. So I think in ophthalmology, we have a lot more agency, and I actually think we have a lot of job satisfaction because we really do affect the lives of our patients and giving them better vision. So I think we don't suffer from it as much as other specialties. However, if we come together to work on those problems, not only do we help solve the problems, but the camaraderie of working together and the hope that that creates on solving some of these problems, I really think goes a long way to treating and or preventing a moral injury. So I'm actually very hopeful for us, even though these stressors are at an all-time high, and I think will actually get a little worse over time.